Trains have become bullet trains. The flights have become faster. We have supersonic jets. We travel from India to America in just less than 13-14 hours now. And you mean to say that dentistry is still in 100 years back? No, never. It has transformed like what I said last video. Today I am going to talk about root canal treatment and its advances in detail.
Build your brand globally. Make your venture a success. Unique Times, Premium Business Lifestyle Magazine.
When I started my practice 20 years ago, I used to like one doctor who was treating root canals in my clinic. It used to take 1 or 2 or 3 appointments, but it used to be painless. And it fascinated me because it was a dreadful experience to see patients getting root canal treatment in my college. So I was so fond and I used to watch him do root canals so effectively. In 15 minutes his appointments used to finish, and next time the patient comes and says there is no pain. And it used to take 15 minutes to take one x-rays, but with x-rays he could find where the root canal ends and where his files used to go, where his fillings used to end, and all those things. It was wonderful watching that excellent endodontist work on patients. But as the years progressed, just in 3 years, I also got the experience of doing wonderful root canal treatments. But this time there was no coming 3 days or something like that. The x-rays became digital. It just transformed it. In 3 seconds we used to get the x-rays. And I used to be so happy because I could get the feel of getting the x-rays done. I am talking about 18 years back. So the root canal just got revolutionized, and we had apex locators. We don't need to take an x-ray to see where the apex is. It just transformed root canal treatments just like that. Now we have lasers, now we have so many other additives which can be used so effectively that root canals have become much more painless. And it is much more comfortable. No more painless, it is much more comfortable. The patient is coming just once. They don't have to travel so many times. So now I have patients all across India, all across the world coming. I have patients from 60 countries coming to do root canal treatments and the crowns in just 1 week, and they go back after seeing this beautiful Kerala. You can see Kerala from my background pictures, how beautiful it is. They come and enjoy and then they just go. Even Keralites, they come just because they are not more worried about toothache. And I always tell that it is better to treat before you get a toothache. But even if it has an ache, don't dread root canals. It is not what they say. The researchers used to do researches to improve every now and then. I know that it used to be painful, but now it is not. How it is achievable? I started doing root canal treatments by using my hand. You might remember if you had gone some years back to a dentist and done root canal treatment, he used to use a file and used to do hand filing. And you know that it is difficult to twist 50 times with your hand. It is very difficult. But now we have RPM controlled, computerized controlled hand pieces which can just go with the correct torque, the correct amount of movements, even flexible files instead of stainless steel files which used to break sometimes. So all these things have revolutionized the root canal treatment. So we have rotary instruments now which is much more precise. It used to shave off all whatever infected tissues used to. We could never imagine that some years back. Now we have the x-rays which is much more precise, which can be zoomed and gone deeper into this thing. It is much more clean and clear rather than on a small film which used to be held on to a light and we used to look like this. That is over. Now we have computerized x-rays which can be zoomed. We can see even the minutest details, so that even the files and the fillings are much more clearer. The fillings also have improved drastically. Because of the material research, we have found out some of the materials used to be some toxic. That toxic substances have been removed, and it has improved a lot over these 50 years. All these things have made painful teeth painless, and that too in 30 minutes. Can you believe that what happened just 20 years back in 5 sittings can happen in 30 minutes? It used to take at least 3 weeks to do this. Now it is just 30 minutes. So this is what has happened. And even now, root canals have improved. Now newer technology will come soon, and now we will be able to even clear up the root canals and give the new life to your nerves and vessels. I hope it will come soon, and we will be able to see live teeth rather than dead teeth after root canal treatments. They say that the tooth used to die, and that is because they used to use mummification agents. You know Egyptian mummy, right? How it is preserved. Mummifying agents were used some years back. Now it is no more used.
Time won't wait for you. Technology can't be redefined. We are ready to start the game. TQ Watches, your style icon.
So, root canals are not making mummies of your teeth. It is actually making the tooth painless and disease free and also infection free. So, make use of all these advantages. Go ask your dentist to do a good root canal treatments. He can do it much better, and you will be able to get painless teeth with absolute confidence that it is efficient and it is very effective and it lasts for a longer time. Why I am talking about longer duration is actually we never used to have a microscope. We never used to have scopes so that we can look into the canals. Now we have that also available. So visibility is much more easier. Our life has been made easier, so your life is also easier. So for more understanding about treatments such as this in every aspect of dentistry, please subscribe this channel. Please send it to everyone who is having pain or difficulty. If they tell that I have pain during root canals, please send this to your friends who have that, so that they will also be helped. Thank you very much.